if you have a pet rat and you're worried about their thyroid in a nuclear apocalypse, as you should be, then that could be a viable option.
That's a pretty good example. Or going to your doctor and asking them about TRT. Good luck. Going to your doctor, asking them about your trip to Mexico. Should you take any prophylactic antibiotics for malaria, for Giardia, for EHEC or ETEC types of E. coli? Prophylactic antibiotics, that's just for paranoid people and preppers, right?
Yeah. Well, one thing I found interesting digging around for this is that Pepto-Bismol is actually pretty effective against, well, I wouldn't bet on it, but if you're going to be drinking the water in Mexico, Pepto-Bismol seems to reduce the incidence of Montezuma's revenge.
That seems like a pretty good thing.
Those that don't know, that's also traveler's diarrhea.
Yeah, that's a pretty good thing to have on hand. Some other high yield things that you could consider is avoiding fluoroquinolones if you could. Those are like Cipro or moxifloxacin, levofloxacin, ciprofloxacin. Given that there's better alternatives specifically for things like traveler's diarrhea, Xifaxan, which is rifaximin, can work quite well. If it is Giardia, then Flagyl, which is metronidazole, works quite well. I've taken that myself in Nepal when I was trekking in my younger years, a story for a different time. And another one that you could consider is Pepto-Bismol, as you mentioned.
Yeah, so I think those are all solid for our first one on the list, Mexico. Is this where Narcan comes on the list as well? I saw Narcan and a sad face in the outline here.
Yeah, I did not mean to put Narcan specifically for Mexico. That's just for, I guess, just general health living in the United States. It is now over the counter. There's a lot of places that you can buy it, and it's very easy to get, which is good for reversing opioid overdoses, like fentanyl overdoses and different fentanyl derivative overdoses. You're much more likely to face that than a zombie apocalypse and save a life that way.
Yeah, and maybe I come at this a little bit biased from my nursing background, but I know that people that get Narcan or some sort of opiate reversal, they aren't very happy. So be cognizant of that, because those people may want to endanger your life if you do indeed reverse their overdose.
Yep, that is very well said. One other thing that I will mention specific to Mexico, or actually not extremely specific, but loperamide or Imodium could be reasonable. There's been decent amounts of studies, and theoretically, if you take loperamide, it does slow the GI clearance of whatever pathogen, whether it's viral or bacterial, and maybe but it doesn't really look like there's a clinically significant increase in invasive infection. So if it's the only thing you have, and it's taking that and not being dehydrated versus not taking it and being very dehydrated, it probably actually does more good than harm, except in cases where you're at risk of C. diff.
Yeah, you don't want to retain the C. diff. And generally your body is trying to get rid of things for a reason, but by doing so, you can get electrolyte imbalances and dehydration. So I agree with that assessment. What do we have for elevation? So, your traditional advice is to slowly acclimate, don't go straight to 12,000 feet or whatever the altitude you're staying at is. But what are things people can do if you're in a situation where you really can't afford, or you don't have the time to spend 3 days slowly acclimating to your travel region before you're going to make this trek or make this hike?
You certainly want to pre-treat with iron, even if you are not anemic or not iron deficient. That can help prevent altitude sickness or high altitude pulmonary edema, especially if you're female or if you tend to get it more often. I know that when we were going to base camp or whatnot for our family elk hunting trip, iron was quite effective when my wife took it. Acetazolamide, which is Diamox, can also help. It basically helps with, it's a carbanic anhydrase inhibitor, so helps with the buffer. One of my fun facts that I like to say is carbonated beverages can make it worse, so you do not want to drink carbonated beverages. So that's why I also drink a nitro beer instead of a carbonated beer at high altitude.
So for all those Boulder, Colorado breweries out there, nitro brews. But yeah, I've used Diamox myself traveling to Colorado and found it to be quite effective. No issues with hiking even on day one of being there. It's not terrible altitude. It's about 5,000 to 6,000 feet. Nothing extreme. And I would probably stay away from the iron in my case, just because I tend to run a little bit high on iron.
Yep. So yeah, talk to your doctor about all these interventions. One other thing that we could mention for both Mexico and Colorado travel in general is a water filter. There's a lot of different types of water filters. We've talked about this on podcasts before, doing your My Tap score, looking for what contaminants are in your water at home or what filter, like a Berkey filter, but not too much Berkey filter because then you can get silver toxicity. But there's things like life straws, and I actually forget the other one that's similar to a life straw that you can just actually draw it up. Sawyer Mini, I think. So there's a lot of
I've
options.
seen the life straws.
Yeah, I think a Sawyer Mini is basically a life straw to where you don't have to, it's like a more tactical life straw. You don't have to reach down to the water to use it.
Because that's when a predator could get you.
Exactly. So it's very primal to not use a life straw.
Then we have boats of all kinds, whether this is a day on the lake, a day in the ocean, deep sea fishing, or a cruise that you're going on. You will enjoy it more if you are not nauseous and vomiting.
Yep.
So scopolamine is a very common recommendation, but another medication we have here is Zofran. And if you go on your very first cruise and you're using scopolamine, you're really not going to know if you're someone who gets seasick or not. So maybe if it's your first cruise and you want a surefire way to make sure you're not sick, you use the scopolamine, because you do have to use that before you get seasick, where it's less effective. So you pre-medicate in that way. Yep. But, maybe once you've done this a time or two, then you sort of test it out and say, hey, do I even need to be doing this? Because it could potentially be an unnecessary medication. Yep. People can always get side effects from these things. Some people get lightheaded or have a bit of brain fog, those sorts of things. So you could use Zofran in a pinch if you find out, hey, I skipped the scopolamine, but turns out I am somebody that's prone to seasickness.
I love the Zofran ODTs. They dissolve in your mouth. You can't really puke them up. I know too many people coming back from trips and whatnot that have needed a bag of IV fluids and some IV Zofran. So that can definitely help out. So I guess we could mention electrolytes and IV oral not IV hydration, but oral rehydration.
Hydration salts.
Yeah. And it does not have to be liquid IV. It can be any sort of hydration salts. It could even be a combination of your own salts.
Yeah, makes your own.
Yeah, mix your own for pennies on the dollar.
And then as we alluded to, radiation. So survivability, and then preserving thyroid function in the context of radiation exposure. We don't know exactly when and where to use this, but we're just looking at the World Health Organization and how it seems to be a bit of an afterthought. And again, that was the most recent recommendation we saw from 1999. But, coming out of a nuclear apocalypse with an intact thyroid, when the supply chain of levothyroxine is questionable, would be pretty valuable.
Yeah, that certainly would. Of course, that only prevents thyroid cancer and not all the other sequelae from radiation poisoning. But it is one thing that could potentially help. And I suppose you could make a case it wouldn't necessarily have to be a nuclear apocalypse. But
what about that rat study with bromine?
Yeah, that's a good question. People that are allergic or sensitive to iodine, although all thyroid hormone has iodine in it. There's a rat study on thyroid hormone that was made from bromine instead of iodine. Bromine being, I forget what they're called, something like a halogen. It's when they're just one electron short of having the full valence, whatever, their full shell full. But bromine is just above it in the periodic table. And your body can indeed incorporate bromine into thyroid hormone, at least if you're a rat. But because of pulmonary toxicity and other issues, probably wouldn't recommend potassium bromine instead of potassium iodide. Theoretically, it would work, but theoretically, it would also cause a lot of harm.
So take from that what you will. There's a reason we don't do everything we see in rodent studies to people.
I'll keep it around for my lab rat.
There you go. If you have a pet rat and you're worried about their thyroid in a nuclear apocalypse, as you should be, then that could be a viable option.
I guess.
Last one is long drives. So this is something that I do quite regularly.
Yep.
And not a long drive by most people's standards, about 6 hours in my case, but there are people who regularly make 12 and 16-hour drives. And when you do that, you can get this sort of, they call it tunnel vision or highway or driving fatigue,
Yep.
or some people could just fall asleep. So what do you do about that?
Yeah. For truck drivers, they have a whole bunch of rules of how much they have to sleep, how much they can drive, logging hours and whatnot. But the Air Force uses something, they use several things, but one of them is modafinil, and they're wakefulness promoting medications for hypersomnolence, for narcolepsy, etc. And they certainly work. I made a drive. I think it was from Tucson, Arizona to Kansas City one time, all in one swath. Can't even remember how many hours it was. Probably 14, maybe even 16. And the modafinil worked extremely well. So it is. There's got to be a threshold. We were asking about this question earlier. What's the number of hours to where, if, like, for example, 12 hours, if you gave everybody driving 12 or more hours a low dose of modafinil, even 50 mgs or whatnot, when they needed it, what would that threshold be to prevent death?
Yeah, it's interesting because we know that with underslept physicians that are doing surgery, residents that are doing surgery, that modafinil seems to improve their function and outcomes. So while driving a car is not quite as complicating as operating on a person, errors still do happen. I imagine you would reduce driving errors, you would improve attention, and that has to at some point lead to less poor outcomes. The number needed to treat, or NNT, is probably quite high there, but it is something that if someone is prone to somnolence on the road, find themselves hitting rumble strips, nodding off, probably something to talk to your doctor about. You could use something like pitolisant, but that would turn your 14-hour drive into a 16-hour drive because you'd be stopping for snacks at every gas station you see.
Yeah, it's a good bulking add-on. Yeah.
So
it binds the H3 receptor. It's histaminergic, mostly specific to the H3 receptor, though. But yeah, that's a potential addition. You could also think about something like Sunosi if you also had sleep apnea. That might be a bit more specific. A norepinephrine and dopamine reuptake inhibitor, usually reserved for those that cannot have good enough efficacy with modafinil and armodafinil, which is Nuvigil. But it can certainly be considered off-label if there's multiple benefits for the right patient.